And can you see the presentation?
Yes, we can.
Okay, great. Well, thanks so much for having me, and thanks everyone for joining and participating. I look forward to talking with you this afternoon about cybersecurity, risk management, and I know this is a topic that we are having to deal with daily and hearing news reports about daily. And it's something that we have to be proactive and consistent about. And so I'm going to cover those topics on how we can best do that and still go about our business. I'm sure you received some general housekeeping, but in short, my housekeeping is that I welcome open mics and conversation or questions as usual. It's always better when people are sharing their own experiences and asking for clarification where needed. I'll be providing a lot of content on the slides. I won't usually walk or talk through each element, but that way when you get the slides yourselves, you can use them for your own training needs. But if I go over something too fast that you wanted a little more information on, by all means, slow me down and I'll be happy to help. So I work with the HITECH Center. HITECH is Health Information Technology Evaluation and Quality Center. We're a HRSA-funded cooperative agreement. Hopefully many of you are familiar with our services. Of course, we provide health IT adoption and implementation services across a number of domains outside of cybersecurity. They're listed there on the right-hand side of the screen. And so we're here to assist, and even better, we're free. And so we'll do our best to assist you with technical needs or training assistance wherever we think we can help you best. And so please do reach out to us, and we'll get back to you as soon as possible. And hopefully we'll be able to help you. And if it's something that we're not specifically able to help you with, then we're usually able to find some good folks to connect you to. All our information, including many of these presentations, are hosted on the HITECH Center website at hitechcenter.org. And so HITECH is H-I-T-E-Q. So please visit. I think there's a wealth of information, guidelines, best practices, including around cybersecurity. Screen there. Up front, it is to say that while we'll certainly be talking about aspects that have legal consequence, that this is an informational presentation only and shouldn't be substituted for legal advice. Please contact an appropriate attorney if you do have particular legal questions that you need answers for. So we'll cover some broad ground. We'll talk just overarching about cybersecurity and its relation to security risk analysis, which to me is the cornerstone of a good, sustainable and hardened cybersecurity model for your health center. We'll talk about ways in which to think through how we strengthen our breach mitigation practices and response plans. We'll talk about current state of affairs in which we have so many more people working remotely currently. We're being encouraged to use, obviously, from the last presentation, there's great opportunities for utilizing telehealth or remote monitoring tools. And so, of course, as we consider those types of technologies, we're always having to consider the cybersecurity implications within them. We'll talk about information blocking, which obviously is something that we're having to respond to as of early April, I think April 5th, if I'm remembering correctly. And so there's some implications within there as it relates to cybersecurity, certainly as it relates to privacy, but also some of the aspects related to security itself that might have an impact on information blocking rules. And then question and discussion throughout, but certainly I'll try to make sure we have some time at the end to cover anything that I don't during the session. So as Donnell said, my bio is out there for you. I work as the domain lead for cybersecurity for the High-Tech Center. It's a field I'm very active in. I'm a professor of cybersecurity at Purdue University Global. And one thing I can say is that there's no one person who can know it all. It's all just, there's so much to cover. There's so many domains within security and privacy that it really is a team sport. And that goes for our health centers as well. Everybody who is a staff member at a health center or your health related organization that you work at, you really have a responsibility. If you're leadership, you have a responsibility to forward a culture of cybersecurity, because we're all using health information systems, and therefore we are consequently impacted by cybersecurity, and we know that the threats are large and continually evolving. So lots of work to do. So like I said, please share your own experiences. That's how I pull this information together and figure out the types of things that all of you need assistance with. So I think the short of it is that all this great technology, we've been encouraged for many years now through funding and rules to adopt health information systems in a meaningful manner so that we can provide better services, more transparent services to our patients, more continuous care. So many great tools out there. And we have found many different ways to connect to one another. And again, that's another thing that we're encouraged to do. And yet, as we do that, we ever increase the security profile that we have to manage. It's one thing if we're a singular site with some electronic health record system software installed on a server in our closet, but it's another thing as soon as we connect all that to the internet, as soon as we start sharing that out, as soon as we start interacting with APIs to increase electronic patient engagement, or as soon as we use third-party services for payment or EHR, et cetera, that compounds the profile of security that we have to cover. And every one of those elements has their own unique levels of security to address. And so it becomes very, very difficult, especially for smaller health centers or health centers that are just getting going to get on top of the cybersecurity game. And so just the first step that we really like to forward is security risk assessment. We see it in the news all the time, and we've been seeing it for a long time now. I think it was about 2015, 2016 when it really started rearing its head, especially the ransomware type of malware that has been targeting healthcare. Healthcare is the most targeted industry, and the threats continue to evolve and are tough to stop, but that does not mean that they cannot be stopped and or their impact can't be decreased. And so that's what we're working after. So as a part of us being able to manage our own security profiles, we have the legislation and the compliance requirements, such as the security rule within HIPAA, that then escalates our need to make sure that we're also managing our vendors effectively and having a documentation that they too are being compliant and responding to the security rule within HIPAA and breach notification rules and laws. And so not only within the technology realm, but also within the policy realm, we see our roles and requirements extended. Now, of course, through OCR, it's important to note that they're taking an active role and looking at how effective we are in documenting the practices that we are doing to help bolster our cybersecurity, as well as should different types of breaches occur, the documentation that we're providing and the response practices that we're doing. And so, of course, we see them in the news. They have the, you know, the kind of the wall of shame for organizations that have had breaches and who had settlements levied against them. More often than not, settlements occur via lack of documentation. It's a matter of you know, the fact that, oh, well, it could have been that there was a susceptibility recognized, right? Maybe it was reported out by penetration testing entities out there that do that type of research, but then there was no follow-up. And so then a breach occurs and OCR investigates, and then they identify that, well, you know, it was an issue that actually had been addressed before, and there's no documentation to show that it was followed up on. And it's those types of incidents that we're seeing penalties assessed, more than, say, you simply not having the strongest firewall available out there. There's always risk, and finding that balance is the name of the game. And I think OCR and other entities are cognizant of that. It's, you know, the general idea is that it's not a matter of if, but when for breach. And so it's not, you know, shame that you have breach. It's a matter of making sure that you're doing what you can, documenting that, and then continually trying to maintain it. One point I wanted to actually bring up here, you know, some new legislation that had come out recently in relation to safe harbor is HR 7898, which essentially allows healthcare providers to reduce enforcement actions by using security best practices. And one of those is adoption of, you know, security frameworks that include this aspect of security risk assessment. A great resource out there is the Health Industry Cybersecurity Practices, or HICCUP. If you're unfamiliar, let me chat this. They actually provide some really great resources for you to be able to use, including cybersecurity frameworks. And so the idea, you know, of course, it's not just, let's see here, where can I chat this? Okay, here's the link. Can't give you the link and talk at the same time. But the idea is that you can actually, you know, it's not a complete slam dunk, but that you can qualify for safe harbor if you can show that you've actively adopted one of these security frameworks. Now, it's not similar to HIPAA and the security rule. It's not prescriptive, meaning it doesn't say you have to use, you know, X framework, just like you don't have to use X encryption. You just need to justify your choice and show that it is actively being used. And so in relation, you know, there's a, you know, good opportunities and great information being provided out there. I think HICCUP provides some really great information, a great background, and some actionable resources. And so I really encourage folks to adopt that. Oh, thanks, Danelle. I did not send that out to everybody. All right. So in short, we're all health centers are responsible for conducting a at least minimum security risk assessment each year, and within that there are key sections that walk people through all the different domains through which they need to address security risk and document that. Now, depending upon, say, adoption of technology, turnover of staff, or perhaps new regulation that comes out there, then at times we'll want to do an SRA more frequently than yearly, but the minimum is yearly. So I don't know that I didn't actually follow up with you on this, Danelle. I just put those in there. So I don't know that we have an actual online poll, but let me just generally ask you, so like I say, that, SRA is not just IT staff or it's not just your security staff. It's really something that everybody should be a part of. And so, just a general, oh, there we go. Thanks so much. So the question is, what is your current experience in conducting security risk assessments? There's 3 different options there. And so if people would still please respond, and Danelle, we can take that. I like your point that it's true. A minute can take forever in the online format.
You just let me know when you want me to close it.
Okay, when you get when it feels like you get the responses are trailing off, then I'll leave it to your best guess when to close it, Danelle. Thank you. We'll give it a few more moments. Now we'll see, but obviously, the hope is. Oh, okay, well, we're well met. So I'll be talking through further about the security risk assessment process. Looks like okay, 20% of you actively help conduct SRAs. That's great. I'll be honest. I wish it was more. I wish people across the health center were more actively involved, even if just surveys are sent out, because we're all, it goes to that kind of public health, see something, say something notion. We're all interacting with systems and people at different points and in different ways, and that's the only way we're going to really understand any of our security gaps. 30% saying you're familiar with the compliance requirements but not actively participate in SRA. Okay. All right. Well, great. Well, hopefully we're providing a little context for the majority of you who said that you did not have background with security risk assessment. Okay. So in general, the security risk assessment rule covers these aspects. So on the left-hand side of the grid here are the kind of big buckets of security components that we are responsible for managing. And so cybersecurity is not just cyber, not just the digital, but it also includes physical security. You cannot have cybersecurity without physical security as well. And so when you work through a security risk assessment, you're essentially working through documenting all of the different physical safeguards that you have in play. How are you controlling traffic into your health center? How are you controlling traffic into your data storage centers? How are you controlling access to different facility aspects, whether those are the dumpsters, right? Those are actually something that has to be protected, much less any server cabinets or things like that. And so you would document, and there's some good tools out there. And so ONC provides some free tools. Obviously, there's many vendors who provide tools for conducting security risk assessments. You could use a spreadsheet. There's not an actual, say, certified tool for conducting security risk assessments. Again, it's not prescriptive to that manner, but you have to cover this ground. But some of the free tools that are out there, ONC has been publishing a tool that's evolving for a number of years. I think it's in its about 3rd or 5th iteration, provides kind of an interview guide of conducting it and walks it through, allows you to record documentation. And so there's some resources to assist out there. So we have physical, administrative, technical, policy and procedural, and organizational aspects and requirements that have to be addressed. And each of those have their underlying variables, and each of those variables then have their underlying measures. And so it does take work, take some time, but it's a living document. So, once your SRA has been conducted at least once, then you just continue to build and maintain that SRA. So, okay, I think we covered it. Every year it has to be conducted. It should be more frequently if you do any big major updates, or you change your EHR or adopt new telehealth, that maybe not a full SRA, but at least a partial security risk assessment to make sure you're not leaving any big gaps in your protection. This is an iterative cycle. It's one of our our life cycles, and so we're continually doing the kind of the loop of analysis, determination of issues, implementation of fixes, evaluation of whether that fix actually worked, and then we start all over again, right? SRAs are, like I said, I believe them to be the cornerstone. So of course we have to have great firewalls. Of course we have to have good intrusion prevention services or intrusion detection services or vulnerability scanners and so forth. All those come into play when we talk about cybersecurity, but your first cornerstone is this security risk assessment, because it helps you hone in on the priorities. There's so much for us to cover.
Dr. Botts, we did get a question from the audience. Do you want to take that now?
Great. Yes, please.
Any suggestions for getting the rest of your organization to understand cybersecurity is not only an IT responsibility?
Yeah, no, it's a great question, and it's really timely right now, because we talk about all these technical aspects, but the key gateway for ransomware or other malware is us, right? It's us using web browsers, it's just us using email, it's phishing attacks. And so that awareness piece is critical. And I think the key variable in that is continuous messaging. And there's some good resources out there that can help you plan around that. Continuous messaging, I think, really trying to open up the transparency factor, really trying to communicate that people don't have to be technical experts, right, to become highly knowledgeable about cybersecurity best practices. And so I think even just beginning with the general, maybe a campaign of sorts, saying that you're going to be kicking off a cybersecurity awareness campaign, and just start with some continual communications around the importance of cybersecurity. We hear it, we take the yearly trainings and things like that, but it's important to remain in tune to updates to it, and big issues that are happening and how they're happening. These ransomware things that were occurring, we saw them explode during the pandemic, because everybody was clicking to find out information about accessing resources or getting the most updated information coming down from CDC, etc. So we saw phishing templates for COVID-19, really explode. But there's some great organizations, vendors out there that do phishing awareness and provide, some of them will do the testing for you to see, what level of kind of attacks your staff are vulnerable for. And then they'll do a kind of a training and awareness program built around the gaps that they identified for your organization. And so there's some great services out there, but I think number one is just beginning the communication process. And it might also mean working with your IT staff to have them help you set up, some surveys or things like that to, kind of get a better idea of where people sit and what types of questions they have. But great question. And I think that's the first place to start with any of this. Is there any other questions, Danielle, that I missed?
Nope, that's it for now. Thank you.
Yeah, hopefully that answered the question, or came close. I'll move through these pretty fast. I have some other sections I want to get to, but in general, the SRA is broken down into particular sections. These are prioritizing around inventory. Inventory of hardware and software is critical because you can't protect that which you don't know you have. Of course, bring your own device scenarios plays into that, and having plans for managing external devices is prominent, and then having scanners available to know what's actually getting on your network is critical. And so these sections help you document all of those pieces. And again, it's understood that you may not have answers for everything, or you may not have been able to implement particular aspects that you've identified as gaps. But it is to say that you're showing that you recognize it, and that you're putting plans in place to document it. Tools such as the one provided by ONC, and it's free. You can go download that tool from ONC or OCR's website, and it's a desktop tool. You could put it on a laptop and use it to work throughout your practice. But when you're done going through it, it'll then give you a dashboard kind of showing the spots where you have the biggest gaps, and then so that's where you're going to focus on, make your plans to harden your systems and increase documentation for your security risk assessment. I think I've covered the reasons for compliance pretty well. We don't want breach, right? Of course, we don't want penalties from OCR, but we don't want breach of our data. There's financial, there's of course our patient's privacy, there's reputation, and there's just overall pressure on staff, and these, when breaches occur, the fallout can last for years. It can take a long time to finally fix those things. And so, it is something that we know we don't want. And anybody who's been through it, I'm sure there's some folks on this call who've been through it who can attest that it is no fun. All right, so next poll is, to what degree do you feel as though your health center is vulnerable to a cybersecurity incident? Do you feel as though you're extremely vulnerable, very vulnerable, generally vulnerable, slightly vulnerable, or nope, you think you got it pretty well battened down? We'll give it a few moments for this. And while we're waiting for that,
I just shared the results, Dr. Bass.
oh, okay, thank you. Looks like the majority say they're generally vulnerable. Now, I'll be honest. I would say that we're all extremely vulnerable. The number of actors out there, and the means that they have, and the target, the focus on health data itself has made us very susceptible. Indeed, we are generally vulnerable. Now, that doesn't mean that your staff or your team aren't doing a great job of managing security at all. But the opportunity is, there's many, the 0-day attacks, right? Those are ones that we just hadn't seen yet. The number of those are increasing, and so it can be very tough, even if we have robust intrusion prevention systems. All right, thank you. So we also, as a part of the security rule within HIPAA, have a requirement for addressing security incident response procedures. And so, like I had said before, it's not just a matter of if, it really is a matter of when. This could be an external breach, an internal breach. It might not be a big breach, could be a small breach, but no matter what type of breach, we should have a plan in place that walks us through exactly how we would respond to a security incident. And this is actually the security rule requirement and would be a part of your security risk assessment. And so in general, that response plan, maybe a number of you are responsible for putting together response plans. It doesn't just have to be a cybersecurity incident, right? It could be response plans for emergencies, obviously pandemics, but within the security rule, we'd be looking at different types of security incidents that might occur. And it's your roadmap. It tells you exactly what you do from point A to point Z in response to that. And of course, this should be something that we know where to go. We know if that ransomware attack occurs, we know where to get the plan so that we know what to do, from the moment it occurs and forward. And of course, that should be a part of your broader training program. And so there's many different plans available out there. There's activities called tabletop exercises. Those two are a requirement. And there's some great resources out there that walk people through tabletop exercises. And there's a couple related to ransomware. Again, it doesn't have to be ransomware, but this is certainly a timely topic. And so, part of these questions that you're working through are, how are we documenting security incidents? What is our communication plan? Should it happen? Who's in charge, during each step? And does everybody know what they need to do? And so if we take, say, ransomware, and someone gets a ransomware email or something that looks like it, does everybody know what their next step should be, right? That's what we're trying to lay out there. And then of course, it's not only during the incident, but based on an incident that occurs, we want to learn from that. And so what went bad? How do we document all the steps that are occurring during the incident and then afterwards? And how do we best learn and readjust our response plans accordingly? So we have the pre-incident that we want to plan for. We have our active response that we need to lay out the steps for, and then we have our post-response. And all these should be a part of your incident response plan. And so, all right, let me pause there. And so this is a lot, right? I understand that this can be a lot to take on. I think it's important to know that you're not alone. And so, your health center controlled networks are there to help you with these activities, support you in these efforts, point you to training, bring folks like the high-tech center in to help you address these needs. Again, if we can't help you with it in some way, then we'll look for, someone who should be able to assist you more. And so look to your HCCNs, your PCAs, and certainly ONC provides support and materials around this, and OCR and others. And so there's lots of tools available out there. I know it can be a lot to unpack, but these are all known things that all health centers have to respond to. So, okay, so we've been working under pandemic, and so just want to share some general thoughts around remote work. This also applies to use of telehealth and remote monitoring. So a quick poll, so where are you at? Are you someone who works from home all the time? I have been, I was pre-pandemic. Certainly that I used to travel a lot more. I've been out to Arizona. Hopefully I've met some of you at times. I've had the pleasure, but obviously that's, we're still on hold there. So do you work home all the time? About half the time, 20%, 5% of the time? Or no, you still, of course we have our critical care staff that are still having to work at our health centers, of course, but we know some of that has changed.
Dr. Bots, while people are responding to that poll, just a quick time check. We have about 15 minutes.
Okay.
I have seen a couple questions come through the Q&A and one in the chat. One is about President Biden's infrastructure bill and whether or not cybersecurity funding should be included in that.
Yeah.
And then there have been some questions about the Cures Act as well. And I know you are going to get to that later, but we have about 15 minutes.
Yeah, great point. So, okay, I'll blaze through here. So, all right, a pretty spread out. We have a number home all the time, a little bit of a mix, and some that work in the office. Okay, or directly out of the office. All right, so we've all been pushed into the online work scenario at some level, of course. And so I'm gonna, in the sake of time, I'm gonna move through this fast, but we have these slides and further a breakdown of this material in relation to, really thinking through cybersecurity at home, because when we're in our home, there are, increased susceptibilities. We don't have, the lockdowns and things like that. And so, of course, we're still vulnerable, especially as it relates to cybersecurity at home. Talked about how we saw a huge spike in the amount of phishing attacks during COVID. And so, of course, especially during these times of emergency, that we see these things escalate. I'll go over this one. Your router, right, is your key network point at this point. And so knowing how to secure your router, ensuring that your computer's up to date, making just good general choices and clicking and things like that are going to be your critical actions for doing it. So there's some very specified guidance on this. Let me plow through there. Passwords still play an important factor, but hopefully people are using multi-factor authentication, of course. And then all of this applies to telehealth tools, applies to the tools our patients are using, whether it's health apps, medical devices, or your patient portal online, right? They too play a part in your organization's cybersecurity profile. And so there's good guidance on and increasing guidance on telehealth, privacy, and security considerations available. Okay, all right, so let me first touch on the infrastructure investment. And so I'm really glad you brought that up. We just had a presentation in the previous hour on use of the ARP funding for cybersecurity investment. So let me find the link here real quick. Give it to you guys. This is a poster that was put together by a group called Online Business Systems, who we've worked with before. And so this is called Strategic Cybersecurity Investments. You guys can download this, and it provides a breakdown. And so, yes, you can use that infrastructure investment for increasing your cybersecurity profile. So thank you for that question. And let me put this into the chat. Make sure I'm putting it to everyone. So here's a link. It does provide a small checklist. We will have the recording of the webinar that was given. Like I said, it was just in the last hour by Adam Keeler, who helped us pull that together. So please check out that resource and get in touch with us. And if you have any other specific questions around it, and again, if it's not us, then we can put you in touch with Adam Keeler or others that might assist. So hopefully that helped. And then, so, okay, let's hop into information blocking with the time that we have left. We have done a number of webinars. In fact, we did almost a 4-part series around this information blocking component. So again, I'll point you to those resources at the end here where you can find further information and recording of the webinars that go into deeper detail. But let me hit the high points here. So we have the 21st Century Cures Act that was established under the Obama administration. That was, I think, approximately 2016. And within it, it has these different rules and sections that encompass the 21st Century Cures Act. And so certainly something that has come to the top lately is then this aspect of information blocking. And so as of April 5th, 2020, we have some new rules around compliance with the information blocking rule. And so let's dive into it. And it certainly has crossovers with privacy and security. So the purpose of the final rule, was to increase rights of access to patients, to increase information sharing overall, increase interoperability, and to increase awareness of our vendors of our want for these aspects within our EHRs, telehealth tools, patient portals, and all the connected services that we use. We want to make it so, right, we have greater transparency, greater care continuity, and hopefully improved outcomes of health and healthcare services. Within that, especially when we're talking about information blocking, we're talking about aspects of electronic health information and how that travels, what are the limitations, and how do we make sure that we share that information effectively. And so, in general, all of us maintain electronic health information, and so all of us are key actors in this aspect. So section 4004 is section on information blocking, and ultimately it outlines what signifies information blocking, or what determines that information blocking is occurring, and what are then the associated penalties, and what are some exceptions in there. And so we'll look at some of those quickly. If you feel as though you are experiencing information blocking, or you hear something from a patient who believes that they are not having their rights to access appropriately responded to, ONC does have a page where you can go in and report information blocking that is occurring. So our key dates, we kicked off compliance for April 5th. And then within this time, we have actually until October of 2022, in which we only have to apply for a subset of healthcare data that falls under the US Core Data for Interoperability, US CDI, and so it's essentially, right, different aspects of demographics, labs, medications, and so forth that are seen as instrumental to patient care that have to be complied with. And then after 2022, October, then it'll expand to all electronic health information. And so those are our key dates. So some of our constraints around it is that, so some of these things are going to absolutely be fuzzy, and getting into, when information blocking is truly information blocking, them keeping us from information that we should have access to, as compared to information blocking occurring because, maybe something isn't working, or maybe there's a privacy or security issue in place. These are the nuances and that will kind of define whether it's actually an activity of information blocking or not. And it'll be incumbent upon health centers and to understand elements of, right, information exchange and sharing and ability to do so that could, look like information blocking that people might need to be aware of and might need to, work with their vendors or developers on fixing. And so, part of it is, interference. We've really had this huge push in promoting interoperability, right? That's our movement from meaningful use, in which we want to be able to use APIs, and we want to use new standards such as the Fast Healthcare Interoperability Resource Standard, or FHIR. Maybe some of you are familiar. It's HL7 messages, right? But a kind of a different format. And so, it's really looking at, whether these new technologies and services that we're using are being implemented in ways that support, sharing of information and do not interfere or block that sharing of information when it's correct. And so it could be a matter of having too restrictive of policies of allowing people to get to that data, such as wet signatures required for patient consent. Could be aspects of not turning on all your things for your technology that would allow for sharing, but maybe you've disabled it because you weren't sure you were ready to take that part of the technology on. These parts should be a part of your security risk assessment. And then or unreasonable delays in getting things working or turned on to not block information. But then we have our exceptions. I'm not going to go through each of these in detail, but there are exceptions for each of these that then can help at least document that you aren't information blocking, but that you fall under this particular exception for this particular reason. Of course, all these exceptions are available to you out there. And so it might be about preventing harm. There might be a good reason, right? Maybe it's a behavioral health, mental health issue, and you are not able to segment the data at this time, or EHR can't properly segment out that mental health or substance use type data that doesn't need to be shared in relation to other aspects of that patient's care. And so that might be part of the preventing harm exception, in which you don't fall under the information blocking category. Many privacy exceptions out there, and many of these would be one by one examples in which we didn't share that. Certainly security exceptions, and so if it's seen that maybe turning on a particular function exposes you to more risk than you can cover or have cyber insurance for, then documentation of that could help you defend, if someone implied that you're conducting information blocking. Infeasibility, your just ability or your system's ability to actually provide the information wanted. Could be a performance issue in which you're simply just not able to act in the timely manner necessary. Again, all of these will require overarching documentation requirements. Content and manner. So again, whether your EHR can effectively report out on the data interoperability core is its own question. And/or after October 2022, now that vendors have the notice that this will be a requirement, whether your particular vendor got your EHR in shape and time to share outside of the US CDI, might be your own exception that you would have to document. And then it is possible for fees to be included, but they have to be reasonable, and you have to have documentation as to why. And then there can be related licensing issues. And so all of these exceptions are available to you. And so, again, as a part of your security risk assessment, it's incumbent upon you to make sure you understand these exceptions, and in relation to information blocking rule, make sure that your systems are configured and that your processes are in place to be able to effectively share when requested. So your pathway is to, of course, integrate these policies within your existence compliance efforts. Make sure you understand the policy. Make sure you understand where the exceptions come into play for your own system, and then define your level of reasonableness for any of these exceptions that you come into contact with. Okay, so let me close out here, and let's open it up for any questions that folks may have on any of the content presented. I know it's a lot. Like I said, I pack a lot into the slides, and so those are available to you out there. These sections are just pieces of larger resources that we have available to you. In fact, let me see if I can quickly find the information blocking link. But in that time, Danelle, is there any other questions that came through that I didn't answer? Anybody want to open up their mics or chat in any responses?
There are not, and I actually don't think we have time for questions. I'm so sorry.
It's okay. I know I ran close to the end.
No
so
problem.
apologies for that. So I will send this link here, which has a number of resources included along with it. And so these include our information blocking resources people can go to. Thanks so much for everyone's time and participation. Thanks so much, Lindsay and team. As always, your HCCN is your first stop to getting assistance with this, but by all means, let us know how we can assist as well.
Great, thank you so much, Dr. Botts. And I know you have an email that people can contact HITECH at in these slides, which people do have access to.
Great.
Really appreciate you presenting this important information for us. Delighted to have you as part of our conference. I did put, HITECH has a survey that they would appreciate everyone completing. So I did put that in the chat. And then Vita, if you'll go ahead and launch the satisfaction poll. This is for us here at AACHC and CBN. So if you'll just complete that quickly. We'll leave the poll open for 10 more seconds. All right, thank you so much, everyone, for completing that poll. Tomorrow's agenda, we're really excited to have our health center best practice presentations to kick off our day tomorrow. That's from 11 to 12. And then our networking breakout sessions, one of which will be on telehealth, which we talked about earlier today. And then we have a bonus session on dental program best practices that will take place from 1:30 to 2:30. So we look forward to seeing you tomorrow. Thanks again to our annual conference sponsor, Arizona Complete Health, as well as our swag kit sponsor, Cintas. And I have received several questions about the conference swag kits. They are in the mail, so you will get them hopefully by the end of the week. Apologies for any shipping delays, but you will get them. Again, please access our conference website to find more information about our sponsors and reach out to them directly. Thank you, everyone. Thank you again, Dr. Botts, and thank you to all of our participants. We look forward to seeing you tomorrow for day 3. Have a great afternoon, everyone.